Hello there. I'm Dr. Izzy Lieberman at the Texas Back Institute. I'm an orthopedic surgeon. I specialize in the treatment of adult, adolescent, pediatric spinal deformity, scoliosis, kyphosis, spondylolisthesis, spondylolysis, and I've been at this for a lot longer than I care to admit. Athletic endeavors and scoliosis are not mutually exclusive. I've had the privilege of treating high school athletes, college athletes, Olympic athletes, rowers, boxers, gymnasts, cheerleaders, football players, and we've been able to get them back to sports. It's highly unlikely that the scoliosis itself is going to limit the athletic endeavors, or after we treat them. My goal is to get those individuals back doing what they need to do and want to do with the optimum performance. And a lot of times that means straightening the spine so that they can still participate at the level that they want to participate in. There really aren't any particular restrictions to sports, but common sense, contact sports are really risky to anybody, whether you've got a straight spine or a scoliosis. If that athlete is willing to accept the risk and conditions himself or herself well enough, there should be no restrictions to soccer, football, volleyball, whatever sport they may elect to do. After surgery, if they need surgery, some of the sports, gymnastics, cheer, things like that, the athlete may be a little bit limited with the range of motion of the spine, but typically they're still able to participate. Life is motion. We all need to move. Physical activity, exercise, stamina exercises, stretching exercises, Pilates, yoga are all a great tool to maintain the flexibility and the muscle coordination that's going to benefit everyone as they get older. As we do age, we tend to stiffen up, the spine tends to collapse down, we develop arthritic shoulders, arthritic hips, and arthritic knees, so again, our mobility is limited. If you work at it during the younger years, you will benefit from it in the later years. Think of it like an investment retirement account. I'm depositing my capital now for the benefit when I'm 55, 65, and 75. And that's where exercise helps all, not just scoliosis patients, but all people. Individuals that have been diagnosed with a curve of the spine are really not restricted. In my mind, I don't restrict them. There may be certain things to watch out for. But like with any athletic endeavor, if you come into it conditioned, if you come into it practicing that sport, you will be able to function at the highest level you can. So the advice is, keep yourself fit, keep yourself in the best possible condition. And I'm not really referring to brute strength. It's more muscle stamina. So it's more lighter resistance exercises, lighter weights, but lots of repetitions. If you look out there at the athletic world, the best athletes are the ones who are agile, flexible, and have the stamina. Those are the ones that have the longest athletic careers. The individuals who are brutally strong don't last. They overwhelm their joints and they develop all sorts of other problems, including back problems, and if they do have an underlying curve, that's amplified.